Amir, it's January. I know loads of people are doing dry January. But in America, the Surgeon General in America, he's said that they should put warnings on bottles of booze saying that they're a cancer risk. Kind of similar to the labels we've got on cigarettes, I suppose. What do you think?
Yeah, I think this is all about people making informed decisions. So when if they do choose to drink alcohol, it's about knowing the risks of it. And the Surgeon General, Vivek Murthy in the US, has said not enough Americans know about the risks. About 100,000 cancers in the US are linked to alcohol, and 20,000 deaths. Cancer-related deaths are linked to alcohol. And he said alcohol is the third most preventable cause of cancer in the US after obesity and tobacco. And some countries are already putting those labels on, like we saw there, that was Canada. South Korea are doing it. The Republic of Ireland are thinking about putting it into place from 2026. And I actually think it's a good idea. The truth about alcohol, Lorraine, is that there is no safe level of alcohol to drink. Even those 14-unit limits recommended weekly by the NHS are limits. You know, it's a compromise, but ideally no alcohol is better than some. And I want to put a myth to bed really here, because some people still believe this myth that a small amount of red wine is good for your heart.
Yes.
And actually that was based on flawed research. And those studies in the past didn't account for that red wine drinkers were more likely to be wealthier, more educated, more physically active, and eat more vegetables. And once those things were accounted for in future studies, the risks of drinking even a small amount of red wine outweighed any benefits. And when we do drink alcohol, it's turned into something called acetaldehyde by our body, which damages our cells. It also increases our hormones, insulin and estrogen. Too many of them can affect cell division and increase the risk of a mutation and a cancer. Alcohol has been linked to mouth cancer, voice box cancer, throat cancer, esophagus, stomach cancer, liver, bowel and breast cancer. So we're not saying, you absolutely must not drink. That is the recommendation, but it's about making an informed decision before you pour that glass of wine.
Exactly. And I know, like I said, a lot of people doing dry January and then maybe continuing it on. But you're right, it's all about getting the balance, and you're always so sensible about that too. And of course, this time of year, not just dry January, New Year resolutions, everybody's doing these, aren't they? But you've got some really interesting ones, and we're told that if you do this, it may help you to live longer.
Yes, small, manageable New Year's resolutions. These aren't mine. They're by a professor in Imperial College who's been studying kind of health as you get older. And these are things that he suggested might help us as we get older and keep us healthy and live longer. The first one, Lorraine, even I was surprised by this, but cutting your toenails regularly. Yeah, apparently it improves flexibility because you have to bend down or at least lift your leg up, and that can reduce your risk of falls. Also, managing your toenails can reduce infection risk as well. I actually do toenail surgery here at the clinic, Lorraine. I do ingrowing toenail surgery, and I'm going to tell you the best time to cut your toenails. The best time is after a bath or shower when your nails are nice and soft. Make sure you cut them nice and straight, your toenails. Don't dig into the sides because I know it's tempting, but it can cause an ingrowing toenail. And leave a little white line. Don't cut them too short. And that little white line will protect the nail bed. And remember to file any snaggly bits so they don't get caught. The other thing he suggested, and I'm a big fan of this one, beetroot juice. So this is all about managing your blood pressure. It's actually quite nice, Lorraine. So it's about managing your blood pressure. Things like reducing salt and eating more bananas is good for your blood pressure. But beetroot juice contains something called nitrates, which are converted to nitric oxide by our body, which widens our blood vessels, which lowers our blood pressure and keeps the cells inside of our blood vessels healthy as well. About 250 mils a day is what's recommended. Be careful if you're diabetic because it can push your blood sugars up. And then, Lorraine, I love this one, kissing. Kissing is good for you. I mean, we've always known this, haven't we, Lorraine? You and I have always known this. But it helps release the love hormone, oxytocin, which connects you to people. But also, actually, oxytocin helps with muscle repair as you get older as well, so it keeps you healthier. And the other big one he found was social connectedness. So seeing people face-to-face in real life and connecting with them socially, because isolation has been linked to premature death and is thought to be as dangerous as small amounts of alcohol, pollution, obesity. So please, if you know anyone isolated, go and see them and pay them a visit.
Such wise words. My new resolution is to not be scrolling on this thing and to get it out of the bedroom, because that's my problem.
That's the hardest, Lorraine. I'll join you on that one.
I think we should all try that. Giving up the booze and giving up the scrolling.
Looking for more health and wellness content? There's plenty more right here on our channel. How about you check out this one?